Hey, good morning, everyone. This is Scott with the Medicare Authority, and we're in the middle of annual enrollment period. And one of the biggest challenges we're seeing is a lot of these drug plans have become suppressed, which means they can no longer be offered, which means as your agent, we can no longer go directly on our websites and enroll you in plans like WellCare Value Script, Humana Value RX plan, or Humana Basic plan, or Cigna HealthSpring plan. So with that being said, when we're doing our reviews, what we're telling a lot of our clients to do, or actually telling all of our clients to do, is go to Medicare.gov, and you can see the address up here, Medicare.gov, and you're going to have to do the enrollment yourselves. That is what the insurance companies are directing our clients to do. So when you go to Medicare.gov, you're going to see this handsome gentleman here, and it's going to say, Welcome to Medicare. And what you want to do is you want to go down to these four icons, and you find the icon that says Find Plans Now, Find Drug and Health Plans. Then what you'll do next is it will take you to a page, and it'll say Explore your Medicare coverage options. And below it, you'll have the ability to log in your account or continue without logging in. I would suggest you just continue without logging in. There's no need to log in. It's just an extra step. Then it asks you which coverage year you're looking for. So being that we're doing our AEP plan reviews, this is going to be for 2026. What I'm going to do is I'm going to put our zip code here in Pennsylvania, and it gives me some options. Lackawanna County, which is by Scranton, that wouldn't be us, or Luzerne County, that's us. The next page after I enter that, it's going to say select a type of plan. So you want to choose Medicare Drug Plan Part D, Find Plans. On the next page, so this is our fifth or sixth page, it's going to ask you the question, do you get help with your Medicare health or drug costs? And 90% of our clients, or probably even more, do not get help. I'm not even aware. Maybe there's 2 or 3 that do. So if you had Medicaid or supplemental Social Security income or Medicare savings program or extra help with drugs, this would be considered PAD in some states. And in New Jersey, it's a different name. But typically, 99% of the time, you're going to say, I don't get help from any of these programs. Do you want to see your drug cost? Now, for this video, I'm going to say yes. I do want to see my drug costs compared to other plans. So what I'm going to do is I'm going to put a couple typical drugs in here these days. And one is going to be a big one, Ozempic, because what we're seeing is a lot of people, they're getting prescribed Ozempic. So you type your name in there of the drug, and typically it will populate the field. And it will default when it comes to dosages to the most popular dosage. As you can see, there's a bunch of different ones. But basically, I'm going to look for the one that's most typical. 3 milliliter pen, perfect. Add to my drug list. Typically, if somebody's taking Ozempic, they're probably taking a blood pressure pill like lisinopril, and I would add that drug there. 10 milligram tablets. So it's going to let you select a dose when you click on it. 2.5, 5, 10, 20, 30, or 40. I'm going to go with 10 every month. And when I'm going to put a statin in here. So I'm going to put rosuvastatin because that's a common drug that a lot of people are taking these days. Rosuvastatin. I don't. Also, if you're of the person that goes every 90 days, what you can do is you can come down here and modify this. So if you were taking rosuvastatin on a monthly basis, one a day, you could say, well, I want a 90-day supply. That's how I choose to get my drugs is 90 days. You can choose a month, 2 months, 3 months, 6 months, and 12 months. Typically 12 months, I see a lot of people choosing when we put inhalers through for them. So if I wanted to get my rosuvastatin calcium every 90 days for some reason, I could modify that down here in the quantity and the frequency. So now we have 3 different pharmaceuticals. And when you're done adding drugs, they're going to ask you for your current location. So I'm going to allow my browser to do that, and it's going to tell me find pharmacies. So we have a medicine shop, which is, mom and pop cooks for Wilkes-Barre Hospital, CVS. So typically, being that there's no more Rite Aids, I'm going to say, okay, CVS is going to be my pharmacy. And then I want to go to continue to view the plans. So the first plan that comes up locally is going to be the WellCare Value Script. That is the lowest cost plan. In Pennsylvania, I believe the premium in 2025 was $0. This year, the premium is increasing to $8.20. Now, you're going to see a couple numbers here. It's going to say monthly premium, total drug and premium costs. So this is the bottom line. This is what you're going to pay totally for a year with the premium and the pharmaceutical cost. And also, this is the deductible. If I want to see how those numbers shake out, and I'm going to use CVS, you see at CVS it's a little lower because that's a preferred pharmacy. So what it tells us is a couple things when we come on here. What our premium is, what our deductible is, and what is the address of WellCare, Tampa, Florida, P.O. Box. Then if I come down, it's going to go to drug coverage. Okay, so I want lisinopril every 30 days, and it's a generic. I want my Ozempic once every month, and it's a brand. I want my rosuvastatin every 90 days or every 3 months, and it's a generic. It'll also allow you to add another pharmacy. It'll also allow you to choose mail order if you like. So what it tells me when I move down is it says my CVS, how far away is my CVS? This would be my monthly cost, or this is actually my yearly cost. My apologies. That's your yearly cost of lisinopril. This is going to be your yearly cost of Ozempic. This is going to be your yearly cost of rosuvastatin. And so this is your total is $701.30 because you're using CVS. Okay? So this is the estimated, but this is the total. I would go with the estimated because it can vary from pharmacy to pharmacy in different geographic locations. This is the standard, but this is based on local. This other chart says estimate my total monthly drug cost based on using CVS. So the first month, January, because I'm taking Ozempic, I have a $615 deductible. That $615 deductible is going to apply the first month. Now, one thing you can do is you can call up, if you choose WellCare or Humana, and you could tell them you would like to be put on a payment plan. So what they can do, whoever your pharmaceutical, the insurance company is, whether it's Humana, WellCare, Horizon, Blue Cross, SilverScript, whatever that would be, you can tell them you want to spread the total cost of the year, which is the $701 over 12 months, and they will do that. They will actually create like a payment plan for you to do that, and you will pay that at the pharmacy. So you can choose that. But typically, what most people do that aren't aware of that is they're going to prep and they're going to say, January is my first month, I got to pay the big deductible. And then the rest of the year, let's say from February to August, my costs will be fixed at $11. And then in September, October, November, and December, that's what my drug cost to be $0 because I've met that deductible. You could also look at the star ratings of the plans. And then if you want to enroll, you just hit enroll. A pop-up comes and it says join. And let's just say I wanted to join the plan. I would put my Medicare number in here, hit I've read, hit next, put my name in here, Scott A. Mazenko. I'll use my dad's date of birth. If I can, 8/28/51. My dad's passed away, so don't want to get in trouble. Mail. Next. Address. Luzerne County. I don't want to have a different mailing address. This would be, so if you have a P.O. box, you would fill that in down here. I want to cover that. That's important. Then uncheck it if you don't. Then it's going to ask you some questions. Do you have any other drug coverage you're keeping in addition? So I'm a veteran and I have coverage if I need it through TRICARE. But for most people, they're going to put no. If you still work and you have drug coverage through an employer, you would put yes. But for 99% of the people, our clients, it's no. Does your spouse work? They ask you this question, does your spouse work? Because do you have drug coverage through them? The answer is no. It asks you, how would you like to get your materials? Do you want it in email? Most people like it sent to them. So I put no, but you could if you like. How would you like, what language? English, and there's some different options. What's the format of the material? So would you like it standard, like 12-point font? If someone has vision challenges, you can get it in Braille. You can get it in large print, which I believe is 16 or 18 font. And then you can also get it on an audio CD. How do you want to pay your PAN premium? So typically, if people are collecting Social Security, they'll say deduct from my Social Security, or if they have railroad retirement board benefits, they would hit this one. But typically, it's Social Security. Now, if someone doesn't want to have it on Social Security, I want to pay the bill each month by myself. So what'll happen is they're going to end up sending you a coupon booklet. And then it'll go through your Medicare number, and I'm not going to submit this. It'll go confirm your address, the answer to all your questions, then you hit submit. But for the purpose of our little demonstration, I am not going to do that. But with that being said, this is a pretty simplistic process to walk you through it. I've taken it slow. If you have more medications, it is going to take some time. So I hope you guys do get some value out of this. You could share with someone that you know that may need to watch this that isn't one of our clients, because unfortunately, we've been getting a lot of people referred to us that want drug plan reviews, but unfortunately, we have over 5,000 clients and we just don't have the bandwidth to do it at this time. So you can share this video with them and direct them to Medicare.gov, because unfortunately, with the way the insurance companies are working now, there is no other option but to go to Medicare.gov to enroll on the plans. And but we're here to keep our commitment to make sure we're reviewing your drugs, because there has been significant changes, and we've been speaking to people that we haven't spoke with in 4 or 5 years, because we're watching plans that were $9, like a Cigna Saver plan, go up to $59, or a WellCare Value Script plan like $2.40 go up 1,000% to $22.80. So if you guys have any questions or concerns, feel free to reach out to us. I am going to create a link for this video, and I'm going to send it out to everybody that I'm currently reviewing their plan after I speak with you. And this will allow you the ability to go on to Medicare.gov and basically enroll yourself in your plan of choice that we reviewed with you for the year. All righty, take care.